all my years in the national the jackpot has never been. This is a life changing.
This is a record.
$880,000.
You can't afford to miss this one.
With this kind of money, the possibilities are endless.
If you don't have a ticket as yet, you need to get one right now.
Remember, we're talking $880,000.
This check is written on your name.
You have to be in it to win it.
Avoid the long lines. Get your tickets now.
We can all help stop the spread of germs and prevent the spread of respiratory viruses like COVID-19 and the flu. Wash your hands for at least 20 seconds. Avoid touching your face with unwashed hands. Avoid skin-to-skin contact with other people. Stay home and away from others while you're sick. Cover your mouth and nose when coughing or sneezing. And finally, clean frequently touched objects and surfaces. For more information, visit scdhec.gov/COVID-19.
Good evening and welcome to another edition of Roundtable Talk. But as we promised, as far as is possible, we will continue to talk about COVID-19, which is the pandemic that's affecting the world at the current moment. And I don't think that we can exhaust any talk where that topic is concerned. Today, we are going to be looking at the role of the National Emergency Management Organization, NEMO, in health emergencies such as the one we are facing today. On the panel, two of the very best in the business in the persons of Director of NEMO, MICHELE Forbes, and Health Disaster Coordinator in the Ministry of Health, Wellness and the Environment, DONNA BASCOMBE. Ladies, welcome. It's also my first all-female panel on the Roundtable Talk, so welcome.
Thank you.
When people in St. Vincent and the Grenadines hear about NEMO, they immediately associate it with hurricanes, earthquakes, floods, the like. Now, this is a horse of a different color. And within the last week, there have been questions regarding the role of NEMO in what is currently taking place. Tell us, what is NEMO's role as far as disasters are concerned, emergencies are concerned, and how does NEMO fit into the current scheme of things?
Well, thank you very much, Teresa, and good evening. The National Emergency Management Organization was established in 2002, and its main role and function is to coordinate disaster management activities in country. And we have embraced what we call the comprehensive disaster management approach. It means that all hazards, not just the natural hazards or the floods and the storms and the hurricanes that people think that is only NEMO's role, but we have embraced what we call the comprehensive disaster management approach, the CDM, as I said, with all hazards, all phases of disaster management, from preparedness to prevention to alert, mitigation, and it must involve all people. NEMO, as most people see it, is the few persons that sit in the office. That is not the case. NEMO involves a whole range of agencies, all agencies of government, the private sector, the churches, all civil society, all agencies, to really coordinate disaster management activities in country. And hence, it is just not focused on the natural hazards, as I said before. So in the case of a health emergency, there are 10 subcommittees of the National Emergency Management Organization, and health services is one of the key committees that is chaired by the Chief Medical Officer, and it has various other persons, mainly from the health sector, within that committee. Now, if there's a health emergency, health takes the lead automatically, and the National Emergency Management Organization supports that health sector in terms of national coordination. If it reaches to that stage, that it reaches to national coordination, you need to bring in other agencies, you need to pull in other resources. That's where NE.M.O comes in. So NE.M.O is not here to take over anybody's function or anybody's sector. It is there to support and coordinate the national activities that may require around any emergency whatsoever, be it a natural hazard or, in this case, a pandemic influenza or infectious disease.
Infectious disease, that's important. Donna Bascombe, let's talk about your role as the Health Disaster Coordinator. What does that entail, and how does that now intertwine with the work of NE.M.O?
Okay, so that's a question we've been asked quite often. The Health Disaster Coordinators program was a PAHO initiative. It's something that Pan American Health Organization has been trying to push for a very long time. They've been saying that health is an extremely important sector. If there is an event, you can't respond adequately without health intervention. It doesn't matter what the event is, whether it's a hurricane or a flood or a pandemic, the response will include health in some capacity. So they've been saying to the ministries of health and the countries that you need to pay more attention to strengthening your capacity to deal with emergencies in health and to deal with, strengthen your capacity to deal with your response nationally. So going on that, after the 2013 floods, when we were really heavily impacted, the ministry took a decision then to create a unit that will focus on coordinating our response in health. That means providing the training, ensuring that we're adequately equipped, ensuring that we have the plans, ensuring that we're linked adequately to the national authority, ensuring that we're not doing anything that is adverse to their plan. So when you build capacities like that health has this capacity, automatically it strengthens the national mechanism to respond. Yes?
Okay. You spoke about a comprehensive disaster management approach in your introduction. What exactly does this entail?
The comprehensive disaster management means that we have to include every aspect of disaster management, as I said, all hazards. So as we're focusing on the COVID response, we look at the health sector along with health and look at those hazards that pose a major threat to a particular sector, whether it's a sector, whether it's the country. If we go nationally, one of our major threats will be, let's say, flooding and landslides. In the health sector, it's pandemic and infectious disease. It has some of the major threats. So all hazards that can affect our country, we need to focus on all. We need to get away from just the hurricane season only. It's an all season now. We're in the drought, we're experiencing drought now. We have COVID, we don't know what next. So we have to embrace any possibilities, any threats that can affect our country and affect our economy, especially, and some of our key sectors. And hence, so the whole comprehensive disaster management approach looks at all the hazards that we can face and what plans we need to have in place as individual departments, as individual sectors, and as a country as a whole. That's where the national mechanism comes in. Then we do not look at just, say, only response or public education, for example. We have to look at all the phases. If we do not treat all the phases equally, then we are going to have gaps. Yes. So you look from the planning, you look from the mitigation, how do we alert persons, how do we provide the information to the public, what do we do to minimize the impact, right, across sectors. And then, of course, it involves a lot of public education and training across all sectors. And it's just not a NE.M.O secretariat responsibility, as Mrs. Bascombe was saying. It's an all. We work together to build that capacity nationally. And because our aim at the end of the day is to reduce our impact on our economy, on our people, on our reduce lives, reduce loss of lives, and no lives in particular. We don't want any loss of life, but reduce the impact of any hazard or threat, whatever the country may face. So that's what we said we mean the whole comprehensive disaster management approach, looking at all aspects of disaster management and all the hazards that we may face.
Be it in health, be it a drought.
Be it health, aviation, whichever sector, agriculture, because each sector now is encouraged to develop their own sector disaster plans. So health is one of the leading ministries, for example, who we have worked with for many years, from the Cricket World Cup, coming down with Dr. Duncan, Dr. Roslyn, Bascombe Adams, Dr. Keyser. They were some of the key persons that have been involved in the whole health emergency management in the last decade. And we have worked with them to build in the capacity, because an understanding that as health is one of the areas that is cross-cutting through an emergency. With any emergency, there's always a health component.
Explain or trace, if you will, NE.M.O's involvement from the commencement of this particular emergency, COVID.
Okay, I'll go back to December, I would say, when I started chatting, when we would have started engaging the health disaster coordinator and the CMO on what was happening, especially in China, and we were monitoring and listening. And from the from the get-go, when the Ministry of Health, Wellness and the Environment started their mobilization, started their meetings, started mobilizing teams since in January.
So as early as January?
Even December we started speaking about it, because we said, okay boy, we had our plan for Ebola, which was that. We had a plan for Ebola a few years ago, which we were key. We're always part of the team, because all plans have to be approved by us in the end.
Right.
Any disaster plans have to be approved by us. So even the Ministry of Health completes their plan, it still has to come to us to review, and we agree on it. So we would have started as early as December, chatting about it. And in January, it is when the ministry started to actually hold initial meetings to bring together the surveillance committee of their health disaster plan, to really start to how we're going to plan to deal with this event, if it eventually comes here. Yes, nothing happened with Ebola, but we don't know what was going to happen with COVID. And then, of course, by the time it was declared a pandemic, we were already in the phase of the surveillance committee meeting, the establishment of the task force, because we had to include other agencies outside of health, and even NE.M.O, that needed to be involved in the whole, looking at the response, how we're going to manage this event. So we are involved in it from the very beginning. From always at the beginning with the Ministry of Health, we have always been there, and then of course as part of the task force. And then when the Health Emergency Operations Center, and that's maybe something we can speak about, Health Emergency Operations Center was established, then we were also there supporting the Ministry of Health. It reached to the stage that the coordination went beyond just the health sector only, and that's where the national system comes in now.
So it's at this stage that the national system
kicks in, because you need to do tracing, you need a facility also that has a capacity to pull up 10, 12 telephone lines in a short space of time, and that is what NE.M.O comes in. So we can activate the Emergency Operations Center, have telephone lines, have privacy in terms of you need to reach need persons who have been quarantined or isolated. We're able to have the psychosocial support teams come in and have their own one-on-one telephone calls, contact with those persons. So then hence it was transitioned into the National Emergency Operations Center. And I cannot just do that alone. For that to happen, the Chief Medical Officer has to request of me for the National Emergency Operations Center and the national system to be activated on the advice of the Prime Minister, because the Honourable Prime Minister is a chair of the National Emergency Council, and I report directly to him, so I cannot just jump in and say, Health, I want to take over your stuff, and we don't intend to take over anybody. Activities. Health is the lead, and we are there to support all the way. So that's how NE.M.O became involved, or had been involved from the beginning.
And is it fair to say that a number of our Caribbean brothers and sisters have actually been pursuing the similar path?
Similar model. In some countries have been different. In Jamaica, from the time they had their first case, the National Emergency Operations Center was activated, which is based at the Office of Disaster Preparedness and Emergency Management in Jamaica, and they go 24 hours most of the times. In St. Kitts, the head of the task force is actually the National Disaster Coordinator, and all operations are run from the disaster office in St. Kitts. In other countries, there's different involvement. In St. Lucia, the NE.M.O in St. Lucia is also involved, NADME in Grenada, and different countries will have different involvement, but the disaster office is critical in this whole management of this response.
As a matter of fact, I see where in the United States of America, FEMA
yes.
Assumed the coordination of the response
and the resources
sometime in March, I think, that they kicked into action. When we come back, we are going to talk a little bit about the task force, terms of reference, what they've been doing so far, and the various stages that we will go through as this process continues. Back in just a moment, and don't forget that you can join the talk via our Facebook page or via YouTube. Send your questions, comments, queries, and we'll be pleased to respond. Back in just a moment.
On Tuesday, April 21st, there'll be thousands of dollars to be won. A lotto jackpot of $845,000. Yes, $845,000. A new home, car, or that college education.
Lotto, you have to be in it to win it.
Next lotto jackpot, $845,000.
COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
Welcome back. We are talking this evening with Director of NTHE, Ms. Michele Forbes, and Health Disaster Coordinator in the Ministry of Health, Wellness and the Environment, Ms. DONNA BASCOMBE. Let's talk a little bit about the task force that is currently managing or coordinating things, so to speak. At what stage of the game did they come into the picture, and what exactly is their mandate?
Okay, so let's start at the beginning. So ordinarily in health, there is regular public health surveillance. So regularly we are checking to see if any of our public health, infectious diseases, anything waterborne, anything vector-borne, anything, see if anything is elevating, right? And we report weekly, internally, regionally, and externally we report. So this surveillance committee that is routinely operating in the Ministry of Health started paying attention to what's happening in China. And as that escalated, we decided that it's time to raise an alert on all levels. So something has to trigger your escalation. So the spread of the virus globally was a trigger. Although they were saying that for us in the sub-region, the risk is still low. as part of the disaster management, the disaster risk reduction framework, one of the pillars is risk assessment. So we were assessing our risk, assessing our capacity to respond, and starting to put mitigative measures in place. Because although they were saying our risk is low, we know our capacity is as small island economies, right? So a National Surveillance Committee decided now that it's on most of the larger continents, and it's difficult to manage, and it's extremely infectious, and humans carrying it, and we're in a globalized world. Our risk has now gone up a little bit more. So we decided, well, it's time to establish our health emergency, activate our health emergency center operations and start doing things more seriously and more focused. Disaster management is very structured. That's why it works. It's so that you don't miss things. You don't miss a lot of things. The Health Emergency Operations Center is health focused. So a lot of persons on this committee are all from health. Now we realize that in this public health events, there are some things that we'd have to collaborate closely with. So if we are to strengthen port and the surveillance at the ports, the seaport and the airport, then we have to get persons from both airport authority, aviation, seaport. We have to get all these people involved. If we have to strengthen that further, we have to get national security. NE.M.O is already on board. We have to get customs, we have to get immigration. These are our frontline people. And so the task force was established to make sure that we're all on the same page. We're meeting, you understand what is happening, we understand what direction we're going in. All of us have to work together to fight what was pending, right? So we moved from the National Surveillance Committee, we activated the Health Emergency Operations Center, and out of that we broke out a task force. Task force because it's multidisciplinary. And each person have their own expertise. I can't tell both what to do. We could only say that for this public health event, we need to do this, we need to work on our forms, we need to make sure that before pratique is granted, we go on the ships, we do what we're supposed to do, we report, we communicate. And as the pandemic progressed, again, another trigger. So now it's in our region, it's in the sub-region. We raise the level again. We move from alert, we are now at a more severe. And NE.M.O is more involved at this point, because from the very onset, you realize that a pandemic is a national event. Most public health events start out at a national level. Of course, the Ministry of Health is the lead, but it has to function as a national event. We do not have all the resources. The NE.M.O is mandated as a national coordinating authority. So that leaves us free now to deal with the technical matters of health. We had to develop new forms. We have to now craft the message. We have to do the research. We have to learn. This is a novel virus. We have to learn about it. We have to talk to our colleagues in the region. We have to weigh and measure the risk. We have to determine what about management. Another pillar of disaster risk management is governance. Who going to drive? Who going to speak? Who going to develop? In our environment, we know once it got to the sub-region, a lot of persons were saying, what is the Ministry of Health doing? Because a lot of the work is done behind the scenes, and you wouldn't hear about it outside. But almost everything that was done was developed, in the Ministry of Health, the mapping, because of the sensitivity of the information. You don't want everybody to know that BASCOMBE is case number 1. You don't want, you want to preserve the privacy. So that is why it's done in such a structured and systematic way. And that is why once it escalates, once there's another trigger and it escalates, you have to take it up to the next level. Yes?
So that's the level we're at now.
That's the level we're at.
So at what stage did the national mechanism kick in? what was the trigger for the national mechanism to spring into action?
Well, we had two first, March 14th was one of the first days we had to actually activate partially when we had our visitor, Trinidadian visitor that came from Guyana through to St. Vincent, where we had to do the contact tracing on the aircraft. So that was one of the first days, but really when we had the second case, where we had to bring in the full team, the psychosocial support, the contact tracing. A lot of the contact tracing is done in the community, though, by the community nurses.
Yes.
Under Dr. Duncan, and they have been doing a superb job. Doing the contact tracing. So by the time we had that second case, where the contacts were quite large, we had to definitely kick in the entire national system, bring in additional support for the tracing, psychosocial support, transportation, quite a few things that was happening. So that was in early April when we had that second confirmed case. But we were involved at the EOC level, health EOC level from that. But really, NE.M.O came involved from that stage, fully integrated at the NEOC when everything kicked in.
What would you say to people who are saying, what does NE.M.O have to do with this?
You have to understand the national system. Most persons are only thinking of disasters and NE.M.O as I said, a storm, a hurricane. But every hazard can be scaled up, or it can be controlled by a local level or a sector level. In this case, this is a pandemic. Yeah. It's an international event. It's a national event that you cannot wait until if we have a few more cases down the road to say, well, okay, you're going to be kicked in, you're going to be involved. And I think we have to continue to educate and inform persons of the role of NE.M.O, and that we're not just there. We don't work only June to November. We work all year round with all different agencies involved. So NE.M.O's role and the framework is there. Most important, the legal framework is there.
Talk to us a bit about the legal framework.
And the legal framework, of course, our Act, Chapter 388, Act number 15 of 2006, gives NE.M.O the legal mandate to coordinate disaster management activities and response and disaster response in St. Vincent and the Grenadines. In Chapter 17, it speaks in Chapter 17, in Section 17, it particularly speaks about all agencies having their plans, and NE.M.O's mandate to ensure that these agencies have their plans and they fit into the national structure. In Section 18, in particular, speaks about the establishment of the National Emergency Operations Center, and that sectors and ministries, departments can have their own emergency operations center, but it must feed up to the National Emergency Operations Center. And once the National Emergency Operations Center is activated, that is the coordinating body. All EOCs have to function and feed in to that National Emergency Operations Center. So the framework is clear, the legal framework is there, the role of NE.M.O is clear, the role of the Health Disaster Services Committee within the national system is clear. So the framework exists to bump this up or to actually take it down. And we cannot wait until it reaches to a stage where you have cases, let's say, we pray that we do not have more cases, but in reality, it's a pandemic. We may have more cases, and we have to be prepared for that. So we cannot wait until it reaches to that stage that we are now getting involved. So it will be too late. And therefore, NE.M.O has to be there and supporting all the agencies that are involved in this response from the beginning to now and going forward.
So what are some of the preparations that we have in place in the event of change in status or stage? What are some of the things that are in place to facilitate a worst case scenario? Worst case,
of course, we have already mapped our resources in country in collaboration with the Ministry of Health. We are collaborating with quite not even locally, regional too, because we have a regional agencies that we meet. We're actually having a meeting now. We meet on every Wednesday. The disaster offices across the region meet every Wednesday to discuss how we're facing this particular emergency, and that's coordinated by the Caribbean Disaster Emergency Management Agency. In collaboration with health, we are at the stages planning if we need to move to X, and we're not able to reveal, what procedures we're going to, what protocols we have to have in place. If it reaches to, let's say a case where we may have to restrict movements, let's say that. what are the protocols that we need to have in place. So these things are being planned in advance. What do we do if X, Y, Z? And of course, the Chief Medical Officer will advise the Prime Minister and her Minister on her recommendations and so on. But that is, we discuss these things internally every evening. We're there planning ahead. At the Emergency Operations Center, we're planning, even on weekends, we're there planning what if we look at all the worst case scenarios. What if what happens? So we are always there. Putting things in place, ensuring the protocols are there, ensuring that we touch base with various other agencies in case we need to bump it up. We have been in contact, for example, with social development in case it reached to a stage that the vulnerable persons need extra support, nutritional support, so those are increased psychosocial support. If, for example, if when the sailors are coming home in the next 2 weeks, whenever it may be, once the clearance is given, we already have them, they're already confined space to come back again another 14 days in confined space. And of course, knowing that there's no job security because the cruise lines will be laying off persons and we don't know when they will be working. How do we get those psychosocial support ready for when these sailors come home? Who's going to do what? So these are some of the advanced planning and things that we are taking into consideration.
Okay, when we come back, I want to talk a little bit about the psychosocial as well as the contact tracing response to COVID-19 in St. Vincent and the Grenadines. Back in just a moment.
This virus, called 2019 nCoV, is new and we are still learning about it. From what we know now, it can make some people a little sick with a slight runny nose. Other people get more sick and can have difficulty breathing and develop pneumonia. Some people get very sick and need to be hospitalized. Among those, unfortunately, some have died. While we still need to learn more about how the disease affects people, thus far, most of those that died had other underlying health issues. This information will change as we learn more about this disease. WHO will continue to provide updates as more information becomes available. If you need more information on the new coronavirus, check the WHO website at who.int.
In all my years at the National Lottery, the jackpot has never been this big. This is a life-changing jackpot.
This is a record. $880,000. You can't afford to miss this one.
With this kind of money, the possibilities are endless.
If you don't have a ticket as yet, you need to get one right now.
Remember, we're talking $880,000.
This check is waiting on your name.
You have to be in it to win it.
Avoid the long lines. Get your tickets now.
Welcome back. Just before the break, we mentioned the fact that on our return, we'd like to expand a little bit more, if you will, on the whole question of the psychosocial support, the contact tracing, which are two very important elements of our response strategy.
Mm-hmm.
Donna?
So we have Been doing things a little, well, we've been doing things a lot differently. We've been doing things. We're very concerned about privacy of suspected cases or contacts of the suspect, family. We know the environment in which we live, and we're also trying to put a lot of emphasis now on the stigma that we're putting on persons who may be a contact or may be a case. None of us is exempted from COVID-19. None of us, any one of us, can be a COVID-19 case. And that's not, it's not like you have a choice that you go out looking for it. It needs a host, it needs a human host. We go about our daily activities, and at some point, one of us may become a case. So we have strengthened the psychosocial system. We have divided it into two teams. One team that would deal with the hospital cases, the persons who are hospitalized for clinical care, and the staff at the hospital, and one team that would deal with the community staff, and persons in the community. Yes?
With Hall, keep your point. Let's respond to a question. Someone wants to know, what is NTHE doing to help suffocate the possibility of virus spreading? To be more specific, in relation to the 300 plus sailors who are expected to return home the end of this month?
Okay, so initially, remember I said that we have been developing a lot of guidelines. We are following the guidelines from the international authorities. We have developed from your admission, your treatment, what we're treating you with, whether you're an adult or a child, your discharge, if you're at home, what you should do at home. If you're at home and you're a case, we're now giving you a little package with your thermometer, because sometimes we take the temperature and you may not think that that is what it is. So you could monitor yourself home. We have a lot of persons who want to do that. We give you a SpO2 machine so you could take your oxygen saturation levels. We give you some guidance. Apart from the clinical staff, now you must also understand that because of the nature of this disease, that you wouldn't have everyday regular contact by a healthcare provider. Every time a healthcare provider turns up to see you, they put themselves at risk too. So to reduce the risk of transmission, you get a lot of telephone calls. Okay? And we have also developed the repatriation guidelines, that is for persons who want to return to St. Vincent. And we're trying to get that as tight as possible. So from before you leave, where you're coming from, your country of origin or the ship, wherever, the things that needs to be in place to when you get here, whether at airport or seaport, when we meet you, what would happen when you come off the aircraft, what would happen on your way to the bus, what would happen from the bus to wherever you would be quarantined, and what would happen when you're in quarantine. It's very detailed. Okay, so it's not like we haven't been thinking about it and tweaking it and redoing it, and there's a lot of work. It's a lot of work that has been done.
And someone wants to know, does NTHE have the authority to insist on schools reopening? What's their take on that, especially given the fact that WHO, as well as the CDC in the United States, have warned about the reemergence of the virus this upcoming winter? What's your take? What's your risk management plans?
Well, in that case, the medical officer of health has already given the schools the guidelines as if they need to reopen, what must be in place. And they have already met this week, reviewed those guidelines. They will meet again next week to review the status of where we are here in St. Vincent and the Grenadines for this pandemic. So it is not that where one has the authority. Guidelines are given, and present it to the Ministry of Education, to the Cabinet, in terms of what must be in place for these to meet.
So the Ministry of Education will be guided,
They'll be guided
by the recommendations,
by the recommendations
of the CMO and her team.
And her team, exactly. So it'll be guided by that and exactly tell you what you have to have in place if schools have to reopen, and basically give you some guidance on what you can start planning for or not plan for, thinking about. So, so it's a process. So it's guidelines and whether you can actually meet those guidelines for reopening of schools. So nobody's going to say, "Oh, we have to open next week," or nothing like that. It's a process, step by step, and it must be dialogue and constant exchange.
Now, we are down to our 13th diagnosed case, 3 of whom have been given the all clear and have now recovered. What are some of the lessons that we have learned from case 1 to current case? Have we learned any lessons?
We're still learning. In every aspect of that word, we're still learning. It's difficult for persons who are confirmed cases in several different aspects. It's lonely. You are confined by yourself and with your thoughts and with your television, where you are bombarded with the bad news, the bad news, the bad news about
the infodemic.
Yes. So there is a lot of stress. They're stressed. We've been fortunate that all of our cases so far are mild cases and can be managed at home. But the psychosocial, the pressure from what is said in the media, what is said by the public, how they're stigmatized, even how we manage, as I said, from case 1 to now case 13, we're trying to do a little bit more, be a little bit more interactive with them. Even with the contacts that we have quarantined, we're trying to be quite a little bit more interactive. Some of them say we even harassing them. We call so often we are harassing, but we just want to make sure that you're getting the right information from the right set of persons and you're not there panicking by yourself. We haven't had to put anybody on medication, as I said. Most of our cases are mild, except for if you have, your underlying things, whether we make sure that you have your diabetic pills on, medication, your routine medication. Also, we have the transition now from once we have a suspect to a confirmation, to finding the contacts. I mean, everybody ought to know their role. We're at that point now. We've done it. That everybody know. You're supposed to do this. You're supposed to be the one calling. Where is psychosocial support? Where is the police? Where is, So that is also something that we have learned and still learning. I want to acknowledge the tremendous work of the community response team that is headed by Dr. Duncan. I don't think a lot of persons realize how much is done and that they have to physically go to find persons. They have to physically go to speak to people. Sometimes we call them out at night to go. We have a kid, we want you to check, and we want it now, and because tomorrow we want to be able to do this or to do that. And then even if you are sent to the hospital, we want to also acknowledge the response team at the hospital. So we have 2 distinct teams, one for the community who go out and do all the leg work, the boot work, the shoelace work as they call it, and then the other team that is responsible for the clinical care of persons. Other lessons, disaster management is hard work. It's hard work. It's physically draining and mentally taxing is putting it mildly. You have to take a lot of suggestions, and you have to take a lot of comments on board to make sure that you're getting it right and you're doing it. So you have to listen. You have to listen. But sometimes you let the noise in, and it demotivates. It demotivates. Any other lessons, Michelle? What do you think from your perspective?
You know, we'll come back to that, Michelle, and I'd also ask another question that I have, but someone wants to know what medication is the Ministry of Health prescribing, since globally there's no medicine to cure COVID-19. Not sure that we did say that there's medication.
Only for underlying conditions, if you have underlying.
For someone who has an underlying condition, whether it's hypertension, diabetes, asthma, and they are on medication, well, it's recommended that they do ensure that they continue to take their medications.
Right. And again, of course, we are thankful that all our cases so far are mild. Right?
That have not required.
Okay, any particular lesson, or is there anything that you would do differently from case 1 and now case 13?
I think we have done things differently already from case 1 to now, and I think Donna alluded to that earlier, in whereas there's a package provided and more information now being provided to the persons, especially, and their families who have been confirmed as a COVID case. So the information is there now. There's a bit more interaction. There's a bit more streamlining of who contacts who. Right, so the community team are the ones who do all the initial contacts, and then if they need follow-up, then they will feed back to the NEOC or to Dr. Duncan, who feed into the NEOC what other support this family or this person need. One of the things is so that's one. Not doing differently, but what has improved in terms of when we started, we were like wondering, how do we get these tests to Trinidad when that may not have been operated? That is has been smooth now with the cooperation of the RSS and CAFA. So now we get the schedule in the evening before as to when the aircraft is coming to pick up the samples, so that the team knows that they have to work towards having the samples ready by the evening or first thing the next morning. So we have those samples, if we have any, to go off to be tested. So that pass has been streamlined quite well, and not just CAFA, really through the support of the Commissioner of Police. He has been the one that has been liaison with the RSS on our behalf for this response.
Okay, someone wants to know, for persons who are quarantined, are there measures in place for them to speak with a psychologist or counselor if the need arises?
Yes.
Yes.
Yes. Yes.
Yes.
Yes, because we do contact those persons in quarantine. They get a call every couple of days. Those who are positive get calls every day. And the team visits. And those who are in quarantine, they do get calls every couple of days to find out how they're doing. So, or if the community team realize that someone is being what should I say, stressed, then they report back and say, okay, this person needs a bit particular intervention in terms of psychosocial support. So that's done on a daily basis.
Yeah, we've actually grouped it where you're assigned, so you know the name of the person you're speaking to, you know their number. So if you need to reach out to them at any point in time, and this is the person who you'll always be talking to throughout your period of quarantine.
So you don't have different persons contacting that same individual.
Our final segment is coming up. We'll be back in just a moment.
COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
In all my years at the National Auction, the jackpot has never been this big. This is a life-changing jackpot.
This is a record. $880,000. You can't afford to miss this one.
With this kind of money, the possibilities are endless.
If you don't have a ticket as yet, you need to get one right now.
Remember, we're talking $880,000.
This check is written on your name.
You have to be in it to win it.
Avoid the long lines. Get your tickets now.
Welcome back. Well, we are back in for our final segment. The time really seems to have just flown by.
Yes.
But I want to talk a little bit about the role of the national hotline in the management of this entire response. What role has that hotline played, and has it been one of the success stories of the response to date, would you say?
I do believe so. It might be a little premature, but I think it was one of the great things that we did. I think we have 4 or 5 lines, and they're physically present in the room from 8 to 4, and then after 4 o'clock, it's directed to their cell phones at home, right? And if while they're taking that call, the line is busy, the spill-off goes to another member on the team. So they're scheduled accordingly. Most persons on the team are trained nurses, and they're supervised by a medical officer. Most persons on the team have the names of the community response teams and who is the leader. So if somebody calls in from a particular district and they figure that that person needs some intervention, they would call the team leader to either call that person, have a conversation on a deeper medical level, or have somebody go out to see them. Additionally, they've been able to pick out persons who they think need psychosocial support. They would get the numbers, they would pass them along. So there's a process for that. We have also included some non-medical persons on the COVID hotline, persons with experience, in call centers and being a social activist and all of that, and that helps for persons who want to just talk.
Okay, Donna, before we'll take this question, somebody is asking, NE.M.O is regarded as the nation's very elite risk management structure. Thus, despite the minister's capacity and respect for such, is it not wise to stand down on reopening schools Are the minibuses willing to transport kids given they are limited by the number of passengers at any given time? The whole world isn't advising school reopening just yet, including our Caribbean neighbors, so why are we even considering it? Is this risk taking or risk management?
So, as Ms. Forbes said earlier, we did meet with the Ministry of Education, and we have given some guidelines as to what should be in place, some of the measures that needs to be in place. The Ministry of Education is also taking on the initiative of e-learning and trying to get the information to the students and trying to identify persons who, so they're doing their own little part now. Initially, remember we said a big part of disaster risk management framework has to do with constant assessment. Constant. This environment is fluid. It changes every day. So when we plan the night before and we get the next morning, we have to revisit that. What has changed in the globe? What has changed in the sub-region? What has changed in St. Vincent? This decision that we made last night may not hold in its entirety. Let's revise this. And that is what we've been doing. It's difficult to say and give a concrete decision right at this point about advising another sector as to what to do. You have to also tell me about your sector. I can't tell you about yours. You know all of the intricacies of yours. I could just give you the guidelines. We discuss, we talk, and we see what is best moving forward. What is best for us next week, up to next week. And next week, let's meet again and assess that. Let's reassess that. Let's see have we improved our capacities, or perhaps if we improved our capacities on the things that needed to be done, then we could revisit full operations, partial operations. So it's a constant system, a constant process of assessing and guiding.
And that's why we say the team will meet with the Ministry of Education again next week. So it's it's ongoing, it's constant risk assessment all the time.
Before we go, one of the questions I wanted to ask is the whole question of confidentiality and confidence in the system. How are we managing that?
It's a little difficult. No, it's a lot difficult in our environment. We are a small island, a small nation. Almost everybody knows everybody. We are mandated. This is a public health event. We are mandated to say, we are mandated to report locally, we are mandated to report internationally, because we have all signed on to the international health regulations where we must report if there is a public health event of international concern. And most times by deduction, persons are able to say, well, it could be this girl who lived there, and in no time at all, the mills are spinning, and before you know it,
so not.
Before you know it, there's a lot of information that's swirling. Some true, some not so true, most not so true. So that has been a challenge, and that is one of the biggest areas that the psychosocial team has to deal with when talking to the cases, because they're always concerned about who's saying what, and who told what, and who called to say what, and why did you come home? And it's extremely difficult. We're working hard to get that done, because if there is no trust, there is no relationship. And the Ministry of Health needs to build a strong relationship with the public. But I need to trust you, and you need to trust me. You need to trust that what we are saying, we're following the international guidelines, we're assessing, we live here, we're also at risk. That we're doing our best and giving you the right guidance, and the things that we may not be able to say is not because it should be said, it's because we think that it's really not necessary. That we know Donna BASCOMBE is a case who live at Sion Hill, who have 2 children going to school, and if we follow the guidelines, you have to treat everybody as if they're a case. Keep your distance, wash your hands, do the cough etiquette.
Very well. There's a question that I want to ask you, Michelle. We are fast approaching the hurricane season. And we know that NE.M.O also has to prepare for that very important time on our calendar. With this current situation that we're dealing with, how will the preparations, how are you going to prepare for while you have this thing going at the same time? What's going to happen with our plans and preparations for the hurricane season?
It has been a little challenging for our preparations, but we are doing what we can given the guidelines. Some of our concerns now, even since February, end of January, is going into the hurricane season with COVID cases. And whereas the Ministry of Health will advocate if you quarantine, but the facility that you quarantine in, is it safe enough for storm? Is it safe enough to withstand a hurricane? What are you going to do when a storm is approaching? And that has been part of our discussion and plan now going forward. How are we going to, with the Ministry of Health, how are we going to manage these cases in the event we have a storm, event we have a hurricane? It has affected our preparations in terms of assessing the shelters as we should have been almost complete by now, because we don't want a vehicle to be going out filled with persons to do the assessment. Additionally, schools are closed and we don't know when they will open. So how do we get to some of the facilities? So it's coordinating very closely now with the Ministry of Education and the private buildings and churches that are emergency shelters. How do we get to assess those shelters in the first place? Because by law, it is mandated that we do the shelter inspection every year, and a list of emergency shelters are prepared where persons can actually go to these shelters. So it is being that aspect. In terms of our public education also, April, May is 12 of our busiest months in terms of going out to the communities. We have, since about February, we have discontinued in March, we have discontinued all of our activities at least until June. So we have now looking at a social campaign in terms of how do we get this information out to the public. We have already started. We're doing some volcano awareness activities for April, and then in May we'll kick in a lot of the hurricane season preparedness information. So we have had to readjust, reevaluate how we're going to get the information to persons using whatever medium we can, and also in the fact that our physical activities have been curtailed, how are we going to now get some of the information to the public? But we have done things. We are getting our.
Do you see any conflict?
There can be some conflict, as I said, in terms of how do we tell people shelter in place. That is going to be a big conflict. Shelter in place, and then of course this is where the public health surveillance will be kicking in the emergency shelters. We have to be big on the public health surveillance in the emergency shelters during the hurricane season.
Okay, ladies, it was a pleasure chatting with you. We spoke with the Director of the National Emergency Management Organization, Michele Forbes, and the Health Disaster Coordinator in the Ministry of Health, Wellness and the Environment. So much more to say, but the time is against us. Thank you. I know you ladies are working pretty hard, sometimes almost round the clock, but we got to do it. Someone has got to do the job, and we want to say thank you guys for being part of the team that's making it happen. This has been our program for today. As we have promised, we will continue talking about COVID-19 as it affects us here in St. Vincent and the Grenadines until such time. My name is Teresa Daniel. Thank you for taking the time to view and listen. Good evening.
In all my years at the National Auction, the jackpot has never been this big. This is a life-changing jackpot.
This is a record. $880,000. You can't afford to miss this one.
With this kind of money, the possibilities are endless.
If you don't have a ticket as yet, you need to get one right now.
Remember, we're talking $880,000.
This check is written on your name.
You have to be in it to win it.
Avoid the long lines. Get your tickets now.
On Tuesday, April 21st, there'll be thousands of dollars to be won. A lotto jackpot of $845,000. Yes, $845,000. A new home, car, or that college education.
Lotto, you have to be in it to win it.
Next lotto jackpot, $845,000.
COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose, or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
In all my years at the National Auction, the jackpot has never been this big. This is a life-changing jackpot.
This is a record. $880,000. You can't afford to miss this one.
With this kind of money, the possibilities are endless.
If you don't have a ticket as yet, you need to get one right now.
Remember, we're talking $880,000.
This check is written on your name.
You have to be in it to win it.
Avoid the long lines. Get your tickets now.